let's talk about vaccines then, Margie. What are the current recommendations for children?
Well, you can understand parents feeling a little bit confused. It's a bit of a minefield, the vaccines, depending on the age of the kids, because the dose of the strength of the vaccine, if you like, the vaccine dose differs depending on the age of the child. But in general, kids are only recommended to get the mRNA vaccines. So that's the Pfizer vaccine and the Moderna vaccine. And as I said, the dose differs. So for example, for teenagers who sort of 12 to 18 years, they're recommended to get the adult dose of the Pfizer and Moderna vaccine. And that's 2 doses, 8 weeks apart. Primary school aged children, so kids 5 to 11 years, we recommend that they get a third of the adult dose for Pfizer, and it's about half of the adult dose for the Moderna vaccine. And then for the littlies, those children who are 6 months to 5 years, they get a 10th of the adult dose for the Pfizer vaccine. So that's only 3 micrograms. And for the Moderna vaccine, it's a quarter of the adult dose, and that's only 25 micrograms. So it's really important for parents listening and providers to know, obviously, that, for younger children, the dose of the vaccine is lower. And in general, it's still those 2 doses 8 weeks apart. But for the Pfizer vaccine in the under 5s, it is actually 3 doses. So, and we can talk about that if you want to go into a bit more detail.
Yeah, I think it can be confusing for families, can't it, because of those differences, but important.
Very much so. And I would encourage parents listening, hopefully I have really, underlined the real need and benefit of children with disabilities and complex medical conditions to get their COVID vaccines, even if they've had COVID infection, and we can talk about that a little bit more. But go and speak to your GP. They'll make sure that they receive the right vaccine and the right dose. They'll tell you the gap. They'll say, have a dose now and come back in, 8 weeks, and they'll really help guide parents through.
Yeah, that conversation with the GP is so important, isn't it? Is there anything else we need to understand about vaccines and children who are severely immunocompromised or have a disability, or those who have a complex multiple health conditions?
Well, one of the most common questions I get asked by parents who do have a child with a disability or complex medical needs is, I'm worried about vaccinating my child because I think the vaccine might not be safe for them, or it might make their condition worse. In fact, it's the opposite. So this is not a live vaccine. It's an inactivated vaccine. So that's another thing that people worry about. Things like the measles vaccine or the chickenpox vaccines, they are live vaccines. This is not a live vaccine. So that's really important for children with lowered immune systems. But it's actually more important that children who are at higher risk get vaccinated, not less important. So these are the kids that we think need protection from vaccination more than anything. And again, a common question we get asked is, well, my child had COVID infection 2 weeks ago, a month ago, they didn't get that sick, they're completely fine, aren't they? And look, we would say, no, they still need the recommended number of vaccines. And in general, we recommend if they've had COVID infection that you wait 3 months and then you get your next dose. So all these children need at least 2 doses of COVID vaccine. Those children with lowered immune systems might need 3 doses. But it's very important that they get the recommended number of COVID vaccine doses, even if they've had COVID infection. And the other thing to say is we don't want children to get recurrent bouts of COVID infection. So even if they don't get necessarily that sick, we know that this is a nasty virus. It can cause inflammation in the body. It can cause inflammation of the heart, of the vessels. It can cause some neurological problems. So we don't want kids to get 2, 3, 4 bouts of COVID infection. We want them to be protected by vaccines, and we still want to really follow those COVID safe behaviours for them and for all the adults in the house so that they are not getting repeated bouts of COVID illness.
I'd like us to talk about those COVID-safe behaviours, but first, can we just talk a bit about medications and antivirals for children with disability or those that are severely immunocompromised?
So there are some antivirals that can be accessed, but these are only for children and adults who are at higher risk of getting very unwell. And again, it comes back to a lot of those complex medical conditions that I talked about before. So for example, children with congenital cardiac disease, neuromuscular conditions, moderate to severe asthma. So if they have a child that is needing recurrent doses of the oral steroid or admissions to hospital with asthma exacerbations, there's a whole list of conditions that mean children can access the antiviral medication. And why is that important? Well, if you give it early, within about 2 to 3 days of the child testing positive and having symptoms, it can prevent them from getting more severely unwell and needing to go to hospital for support and further management. And that's the same with adults. So I would encourage parents to have that conversation with their GP or their specialist. Often we're recommending that they have a script for the antiviral medication at home, because the key with this medication is it does need to be given within the first 2 to 3 days, really, for it to have the best benefit for the child and to stop them from getting very unwell. So there are antiviral medicines that kids can take, but they are only available for children and adults who are at higher risk of getting COVID infection.
Thanks for clarifying that, Margie.
The other thing I should have said, Kerry, of course, we talked about vaccination and the recommendations for vaccination and why it's so important, particularly for children with disabilities, to have the recommended number of vaccines. But one thing I think we should touch on is vaccine safety, because parents often say, oh, I don't know, my kid just didn't get that sick and I'm really worried the vaccines aren't safe. And, like I said before, there's even that belief that they'll be more unsafe with children who have disabilities. And what I want to reassure parents about is that these vaccines are really safe, and that there's a very, very robust vaccine monitoring system in Australia called AUSVAC Safety. And that's actually pretty cool. It's this system of, general practices that participate across Australia, more than 500 practices, and adults and children, so parents of children who get vaccines in these clinics, get text messages, excuse me, 3 days, 8 days, and about 40 days after the child gets a vaccine. And they're asked to report any symptoms that the child may have had, things like a local reaction, fatigue, headache, muscle or joint pain. So this way we're actually able to track and monitor these symptoms in the community, and we know how commonly they occur, so we can reassure parents. So, for example, about a quarter of children will experience a local reaction, a sore arm, a red arm. About 10% will experience some fatigue. About 7 or 8% will get a headache, and about 5% will get some muscle pains. And that lasts about 1 to 2 days. But importantly, less than 1% of children actually need to go and see their GP or a doctor for treatment of these symptoms. So in the most part, they might have a day at home where they feel a little bit lousy or off. They may have some Panadol or some Nurofen, but in general, they're not that affected by these side effects. And, parents usually don't need to stay home from work, for example, to look after them. So, and I think it's really important that we as doctors and, as parents, we share our stories about vaccination. We talk about getting the vaccine, what we experience, so that everyone knows it's normal and common to experience some of these side effects. Doesn't mean that the vaccines are unsafe. It's actually completely expected that we'll get some of these side effects, but they don't last long. They're not serious. And then there is that one sort of more serious or rare side effect that I think we should touch on for parents, because we know that they ask about it a lot. I certainly talk to lots of parents in my immunisation clinic about this potential for children to get inflammation of the heart muscle or the lining around the heart. And that has, a long name. It's called myocarditis or pericarditis. And we did see this initially when teenagers started to get these mRNA vaccines, and this most commonly occurs in teenage boys around sort of 17 to 18, and it's more common after the second dose of COVID vaccine. And, you know, what happens is that young people can get a bit of chest pain or a little bit of an irregular heartbeat. They'll need to go to their doctor. They may need a night or two in hospital, but they do recover. And what's also really important for parents to know is that this inflammation of the heart has been really, really uncommon in primary school age children, and we almost have not seen it in children under the age of 5 from the vaccine. And in fact, this myocarditis or inflammation of the heart muscle is much more common with COVID infection itself. It's about 7 times more common. So that's a lot of information, but I think it's worth just dwelling on the safety of the vaccines and what parents can expect, because it's actually a very safe vaccine.